Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Peritonitis. So what are the types of peritonitis? There is a spontaneous bacterial peritonitis. There is a secondary, the bacterial peritonitis, and this is due to the visceral perforations as well as the peritonitis, and this is in case of the chronic ambulatory peritoneal dialysis. So this is also known as the CAPD, that is a chronic ambulatory peritoneal dialysis. Now let's look into the spontaneous bacterial peritonitis. So here it occurs with the ascites. This is important to note. So there is a presence of ascites. The most common cause in case of the adults, this includes the cirrhosis. This includes the cirrhosis or the chronic liver disease. So this includes the cirrhosis or the chronic liver disease. The most common cause in case of the children, this includes the nephrotic syndrome. So the most common in children is the nephrotic syndrome. The most common in adults is the cirrhosis. The pathophysiology involves a translocation of the bacteria from the gut to the ascitic fluid. So usually there is a monomicrobial infection. There is a monomicrobial infection, and most common organism in adults, it includes the E. coli. So there is E. coli, which is greater than that of the Klebsiella. Now most common organism in case of children will be in adults we saw it's a E. coli greater than that of the Klebsiella, so EK, and the organism in children is going to be group A. So it is a group A, that is a Streptococcus. Now the clinical features includes abdominal pain. So there is abdominal pain as well as there is a tenderness and there is fever with chills. So fever and chills are present as well as rigor and the tachycardia. What is the diagnostic criteria here? The diagnostic criteria is there is a monomicrobial. There will be a monomicrobial growth. So the monomicrobial growth is present in the culture, and the neutrophil count will be greater than 250 per mm. So treatment is by the SBP, and there is a IV C4, the cefotaxime. So IV cefotaxime is also present, and this is along with the albumin. IV cefotaxime plus albumin to address the hypoalbuminemia. Next is the secondary. The secondary bacterial peritonitis, it results from the visceral perforation, and it can be small or the large bowel. The polymicrobial conditions with organisms like the E. coli and also the bacteroids. So bacteroids fragilis. Now how do you treat this? The treatment, it involves exploratory laparotomy. So exploratory laparotomy, and there is a peritoneal lavage. Exploratory laparotomy, this is peritoneal lavage, as well as the repair of perforation and the stoma formation in cases of the massive contamination. Next we move on to the peritonitis. The peritonitis in case of the chronic ambulatory pulmonary peritoneal dialysis, CAPD. So what happens here in the CAPD? It is used in patients with the chronic renal failure. So it's used in cases of chronic renal failure who cannot afford the transplantation of the hemodialysis. So can't afford transplantation or the hemodialysis. So peritoneal catheter is inserted, and after the catheter is inserted, the dialysis fluid is introduced into the peritoneal cavity. So into the peritoneal cavity it is introduced for the toxin exchange. Now the common organisms causing the peritonitis, this includes in case of CAPD, it is a staph epidermidis. Now the treatment is, it includes the intraperitoneal. So intraperitoneal instillation, and this is of the first generation cephalosporin, CS, and this is by the catheter. And recurrent peritonitis may require a catheter replacement. So there's a catheter replacement can be done. To learn and grow daily like this, please do subscribe.